Yay tall.
Yeah, little.
Yes, and we are live, so I'm going to shut off my email so it stops beeping at us. And luckily, as I said, the Amazon guy's already been here, so my doorbell should not ring.
Perfect.
And we'll see when some people jump on.
Okay.
There is about a 30-second delay till comments show.
Okay.
So, and questions will go away after a period of time. You can only scroll back so far.
Okay. Got
If
it.
we have somebody on here, please let us know where you're watching us from and if the audio is okay for you. And if you can actually see us, because that was a problem we had on Tuesday.
Technology.
We can hear you, but we can't see you. It was, there's always something. And people are jumping on like crazy.
Awesome.
So we'll take a chance and say welcome hi Diane, to another Facebook Live in support of the Healthy Dog Expo. My guest is my wonderful friend, Dr. Debbie Torraca of Wizard of Paws, and one of the, if not the, I always say the foremost canine physical therapists on the planet.
Oh, Lord, thank you.
How are things going?
I am good. I am in the middle of Charleston. I'm at if you guys can see this, the inaugural. So it's the BSMR Symposium. So it's the American College of Veterinary Sports Medicine and Rehabilitation Conference in Charleston, South Carolina. So it has been incredible to attend some of these incredible lectures and also catch up with friends from literally all over the world that I haven't seen in so long. So it's been really thought-provoking, and I'm already sitting in some lectures thinking, okay, we need to research this. We need to do this. Like, let's see what else. So yeah, it's really exciting.
That sounds awesome. How many people do you think are there?
I would say there's about 350 people here.
That's a lot.
More on the canine side, but the equine side is very well represented. And so good to just listen again to the research and all of that. And definitely, listen to different ideas. And the keynote speaker before lunch was a human physician specializing in sports med and talking about the comparisons and returning athletes to their sports as quickly as possible. And it's interesting when we think about that. And he had said, your canine patients that participate in sports, they're not just patients, they're athletes, and they need to be treated as so. And we think about that also with the horse, and so different goals of looking at everything, and so really cool.
There was an article in the New York Times referencing the United States women's soccer team and the recent rash of ACL injuries.
Yes.
And the point was made that they are now having as many matches per year as the men's team is, but their physical therapy and medical support is not on par. And recently, one of the star players actually tore her patellar tendon, which I didn't even know. I never even thought of that.
Right.
For those of you who don't know, that's the tendon that basically your kneecap is kind of embedded in. And it attaches just below your knee to the front of your tibia. And it's a massive tendon.
Absolutely.
And to think of rupturing that, most people rupture it right off the bone.
Right.
It's like hit by a truck kind of accident, and they're doing it playing soccer.
I know. And you also, you start to think about the correlation between the hormones with cruciate injuries. Certainly we see that in people. There's such a difference between men and women, and we know women are more prone to tear their ACL at different times of menses, but we look at our intact females that are active in either the field or agility or anything like that, maybe just playing around the backyard, and what's the tendency to tear during their cycles and stuff like that. So pretty cool stuff.
not even considering genetic predisposition, body condition. Obviously, these athletes are in better shape than some of our
Yeah,
dogs. And nutrition. I mean, that's a
absolutely.
huge component.
Absolutely. I always joke that, certainly can look at our athletes, and I love Michael Phelps. We can look at him, and I always tell my clients that we know that he's not eating McDonald's or Burger King or just crap. He's taking great supplements. He's doing everything he needs to. He warms up, he cools down, he strengthens, he prepares for the events. And
Mhm.
so it all comes into play. So nutrition is so important as
Yeah.
everything else when we consider. So
Yeah, and
definitely.
how many people take their agility dog out and literally go from the crating area, be that in their
Mhm.
car or indoors,
Yeah.
maybe to the warm-up jump for 3 jumps, and then they're in
Yeah.
the
Right. Exactly. And I cringe at that. And we would never again, if no matter what level you think about these dogs competing, or even if they're going out for a run or a hike, I mean, that, the need for a warm up and cool down and proper conditioning. Agility is not the training, that's the activity, and it needs training and proper
Yeah,
preparedness. So,
yeah. And the other thing that makes me cringe and, is the recreational, I'll call it, agility person who, an old friend of mine used to refer to it as doggy bowling. But, there is no training phase of the obstacles, but just, let's take the dog on leash and run them over the dog walk and up the A-frame,
right,
and basically just lure the dog through the
right.
obstacle. So there's no mental connection, there's no training, there's no warm up, there's no nothing.
Yeah,
And they might be 6 months old.
right, exactly. There was a great lecture yesterday talking about the impact on the body, both the forelimbs and high limbs at different levels of jumps, and comparing, a higher, uh, a dog of higher athletic caliber, if you will, versus a
Mhm.
lower. And the lower dogs that maybe didn't have as much training were a little bit more careful with the jump, so less likely to get injured, with regards to their shoulder. Um, but we were talking about just starting some of these high level dogs are started so early and they're weaving so
Yeah,
early on, and what kind of damage is that doing to the medial glenohumeral ligament or the shoulder, and why are we seeing so many more shoulder and iliopsoas injuries? So
yeah,
pretty
it
cool.
seems like the psoas is just injured in every 3rd dog out
Oh
there.
yeah, yeah,
Um,
yeah. It's so true. And I had an owner, a Labrador breeder, kind of get annoyed with me because she was hiking her 4-month-old lab
mhm.
4 miles, and I said,
Oh
no,
my.
not going to happen. And she had asked her vet, and I said, well, we're going to stick with the same answer. Like, that's not going to happen. That's,
Yeah,
always, just it's going to lead to so many issues. So
yeah, and
but
especially the lab puppies that tend to get roly-poly
yes,
and have no regard for their body because they're just 200% enthusiasm
right,
life.
exactly,
Um,
exactly.
it's crazy. It's
Mm-hmm.
so this conference you're at is geared
Mm-hmm.
to sports medicine, but everything really applies to the pet dog as well. Thinking
Yep,
of the especially cruciates, which seem to be
absolutely. And I always say if we get down to, when treating whether it's a sports dog, whether it is a wonderful pet, we're always going to find the lesion in order to treat the lesion. And I think that, as simple as that sounds, that's so important. So we need to know it's a cruciate tear, or it's hip dysplasia, or it's an iliopsoas, or maybe something a little bit different. And then we treat with that multimodal approach. So the reduction of pain and inflammation, and then we can restore strength and function, all depending upon what we need to do, whether the dog is going to be out on a golf course chasing geese for 8 hours or
Mhm.
walking down to the mailbox.
Yeah,
So It just all depends on what they need. So,
Yeah, and get them back to function in a thoughtful manner.
yeah.
So you use a huge array of tools to do this.
Yes.
Um,
So, yes, we definitely, and, in treating pain and inflammation and to promote healing and get blood flow increase, get those nutrients. I love my laser.
mhm.
We utilize multi-radiance lasers, and there's a spectrum from the professional, which is a class 4 and has a lot of different settings. And what one of the things I should say I love about this company is they make a home laser. So I
Right.
have found that has been a game changer during the pandemic,
Mhm.
certainly, but also, I would love to see dogs in the clinic sometimes twice a week. Doesn't always happen, certainly if they're
Yeah.
traveling, but this is something that the owners could rent for a week, a month, or even buy and treat once or twice a day. And
With your guidance, yeah, and
Mhm.
certainly during the pandemic,
Oh, yeah.
we didn't always have openings for someone to come
Right.
in 2 or 3 times a week.
Right. And it really, I look back on the pandemic and think about it, of everything that we did. And then, now, even just as a supplement, whether it's cruciate disease or a post op,
Mhm.
neurological or degenerative myelopathy, anything that is wounds, has just been incredible to have the owners work on this at home, and game changer, especially those old arthritic dogs.
Yeah.
There's so much going on and there's so many areas. So it's just lovely to, have the owners work on them at home. And it's just been
And
just
now
great.
that we're all so comfortable with Zoom and everything, if you need
Yes.
to check in on them and see exactly what they're
Yes.
doing, you can.
Yeah. We have, I think, 7 in our clinic, and there's a waiting list
Wow.
for, and it's been wonderful. And even my, long distance virtual consults, all of that have been benefiting, and it's been great.
Well, and Multi-Radiance is probably one of the most generous companies out there, and
Yes.
they have actually given us one of those lasers to raffle off. So
Yes.
one of our expo guests is going to go home with one.
And I'm
Which
so
is
excited. I was so happy, yes, when they did that, because it is just such a great gift, and
awesome.
it's wonderful. I know
Yeah,
someone's asking about, along with laser, utilizing the Assisi loops, and certainly. So the Assisi loop is targeted pulse electromagnetic field therapy. So it'll depend what we're targeting, and what kind of setting, the depth of tissue, that sort of stuff. But we can definitely use them, together.
yeah, and, I had a client with a German Shepherd, older, arthritic hips, mainly age related, but also German Shepherd. And the Azizi loop was a wonderful relief,
Hmm. Hmm.
and she could park the dog on her dog bed, loop over
Absolutely.
loop over the hip, the dog was in heaven.
Yep.
So, yeah, and that's another bonus, another home modality
Hmm.
that can be taught to
Yeah.
use.
And there's so many, we think too about the dogs that may be reactive. They may not do well in a clinical setting.
Right.
For those of you that have cats or, other small animals that don't do well, coming in. I mean, trust me, we have our ducks, our guinea pigs,
Yeah,
our chickens.
let's dive into that.
Oh,
You
yeah.
have treated, in the time I've known you, donkeys,
Hmm.
um,
We had an alpaca in the clinic.
yeah.
Uh,
Did you do a giraffe or something? You were at a zoo.
Yep, we've worked at zoos. They haven't come in the clinic, but I've definitely consulted with giraffes, sea
Yeah.
turtles, the Mystic Aquarium.
Oh,
So,
yeah, I saw the pictures of you at Mystic.
yes, the penguins get thoracolumbar disc disease and all this cool stuff. And
Yeah.
then in the clinic, we've had many, many ducks. We had a turkey, a chicken, guinea pigs,
Mhm.
lots of all that stuff. So a goat, we just had a baby goat, a little calf. So I never say no. I'm like, you know what? It's a living creature. The tissues are going to respond.
And
It's
and,
so
you
good.
know, you might learn something that benefits,
Hmm.
your more conventional clients.
Yes,
But I love that you're open to that, and it just
absolutely.
keeps it fun.
Oh gosh, yeah. And it's always, I'm like, oh, I need to mobilize this duck's neck. This one in particular, for her to be functional, she was attacked by a weasel, and she couldn't bring her mouth down to the ground, so she couldn't eat. So we were working on mobilizations, and one of our functional goals was for her to go down, pick up a night crawler, which was gross,
Yeah,
pick it up and kind of kill it and then swallow it. So I was like, okay. Once we had that down, I'm like, enough with the night crawlers. We're good, and
we can
all of
we
that.
can go to some other foods.
Yeah, I was like, ugh.
Yeah,
But
but that's what they do.
hmm
Um,
yeah. And you always go back to, like, people say, oh, you're not going to believe this. Like, my dog does this, So that's your dog's function. Who cares?
mhm,
If, like, for you, a good success or quality of life is them burrowing under your pillows, then let's do
mhm.
that. Let's get them back. So, yeah.
Yeah, yeah. 'Cause people are always talking about quality of life, and, a
Mhm.
lot of times they're talking about basic function and lack of
Yep.
pain, but there's also that aspect of enjoyment.
Hmm.
For my youngest, she's in love with her food bowl,
Hmm.
carries it around,
I love that. Yes.
and when she's happy, she goes and grabs her bowl.
Yeah.
So,
Yeah.
the day she can't do that,
Yeah.
we'll be talking.
Yeah. No, and it's true. So, like, I always ask my owners, whether they're live or virtual, what does success look like for you?
Mhm,
Because it could be anything from just something, walking outside, or getting upstairs, going, to their bed, or, anything like that. There's a lot of, we have to look at each individual animal and what we can do for them to help them.
yeah.
So,
So what other tools beyond the laser are you
yeah.
using mostly today?
So I love my Piazza Wave Shockwave,
Mhm,
and it is does not require sedation.
yeah,
So that's something very, very cool. And I love that on joints, but also soft tissue injuries. We have to keep in mind that photobiomodulation or laser, and a lot of times PEMF is contraindicated if a dog has any type of malignancy or cancer. Um, also, like, sometimes where shock waving in the clinic, and then they're using the laser at home, which is great, especially for those clients that come from a distance, or we're pushing hard to return them. And the shockwave also reduces pain. It's using these acoustic waves to help reduce the inflammation, and it's a wonderful tool, and it's not painful. So often I tell owners shockwave, and they think, oh, just the
I
term.
remember when it first came out and it was so loud.
Correct. And this is a
And
different system.
yeah,
So that loud system still exists.
it
And
does, okay.
um,
And sedation, was recommended.
right. And I just think, too, for my purposes in a rehab clinic, because usually we're using modalities or hands on, and then they're moving to exercise, underwater treadmill, that sort of stuff. And
Mhm.
I don't want them sedated. I want them
Yeah,
fully with it.
yeah,
And,
definitely.
I definitely being able to tell me if they're in discomfort or not.
Yeah.
So,
Janet has a good question, since we were talking about this.
yeah, thank you, Janet. So really, really good question. And I think, there's been some discussions, and there was, I think, last year, a veterinarian put up information about dogs in the wild, and they're not restricted. It was sort of interesting because I was playing devil's advocate. And I think so often with our puppies, if we decide they're going to go on a 2-mile walk, they don't have the option of resting. So they're going to do whatever we want because they love us. If we let them run around and play outside, they're going to sleep when they're tired. They're going to do that. So ideally, when growth plates are closed, we can start pushing them further. I think, and it's not definitely the rate of growth closure differs from dogs in, from Shelties to Great Danes, certainly. But if we look at about 5 to 10 minutes of activity per month and just use that as a guideline, so maybe a 6 month old, we may do 30 minutes of activity, but smartly. So like dogs that are working in the field, and yes, they're lighter than maybe your average, but we still want to think about the ramifications on the growth plates. I tend to see a lot of digit injuries because they're compensating so much. When their feet strike, they're becoming hyper mobile and see arthritic changes way too soon. So I like to stick on the conservative side. And, even with those guys, a lot of dogs that are, you're starting to work in the field and you may be running them with other dogs, is just, proceed really cautiously. You can't go wrong with the growth plate closure or just waiting. Certainly resting them if they're sore, and not pushing them through a variety of movements. When we look at the American Little League Association, there are restrictions on what children can do up to the age of 18. We don't have that in veterinarian medicine, but I think certainly different dealing with a quadruped versus biped and all of that sort of stuff. But I think it's something to think about, as we start to like push them. So
Well,
yeah.
and the Little League, that's interesting because I think of, the motions a pitcher goes through to throw, and how many professional ball players that have benefit of everything
Right.
crash their elbows.
Right.
And
Right.
to think of someone whose growth plates aren't finished, putting that stress on.
Yeah.
And probably too, women's softball with the fast pitch.
Yeah,
Same thing.
absolutely. And I think too, when I always love to look at, I'm a baseball fan, and you look at the pitchers and before they release the ball, they're in so much external rotation and it's an excessive amount of movement. Well, this excessive amount of movement is also present when dogs jump out of the back of the car and they land. And their wrist goes into an extended part of motion, and it's pretty interesting. So
yeah, and all of these motions that we're talking about are repetitive. It's like the person training weave poles with a puppy that's too young, or even a dog. They do 20 sets, and it's the surprise.
Right. Right. Someone mentioned the Tommy John surgery. Absolutely. You look at that and, we know more in the human sports med, but we're starting, medial shoulder instability issues are huge in these sporting dogs, and they're being identified as early as 18 months of age. And why? Shouldn't be. So,
other than we're doing stuff that we shouldn't be with them.
Right. Correct. I know someone had a question about an older dog. So at the expo,
I think I can pull that up for you.
Okay. And at the expo, I am talking about knee injuries or stifle injuries, but we'll definitely be talking about the older dogs because age is not a disease, right? So one of my pet peeves is I hate when owners will go to their vet and say, hey, my dog is, not walking as much. Oh, he's old. No, like that's, yes, we have to respect the aging process. And, I think diet supplements play such a huge role in that. But also getting back to, is that older dog in pain and it hasn't been identified? And we're not going to have that ability to produce strength and endurance if pain is not treated. So if we can identify, and I mean, Lori, you and I are not spring chickens anymore.
No, we aren't.
I definitely get up and I'm like achy and all of that. And we have discomfort, and part of it we could walk out of, other parts, kind of stays with us. So, days I'm not feeling great, I don't want to get on my treadmill and, do that sort of stuff. But, when I actually pay attention to myself and treat myself, we can, I start doing, more. And the more I build up strength, the less I have episodes of back pain or neck pain or, that sort of stuff. So the fact, Lauren, that weekly hydrotherapy is fantastic. That will certainly help. And I'll be talking about that at the Healthy Expo, because you can definitely, help with that, and then increasing core and stamina and all of that sort of stuff. I love getting these guys, like I said, on, even if they've been on some supplements, changing it up. We now know that the UC2 product is more effective in treating joints. So Jope has come out with an incredible product that we've just started selling in our clinic, and we're working on a pilot study, which I'm excited about. And and see, Lauren, that it's terrific. Like, I
You're
am
doing a lot of things right.
yeah, raw advocate. That's so awesome. That I am a raw advocate. I don't think it works with every dog and owner, but there's definitely other things, to do. So, and there's so much that you could do at home. And like I always say, when again, do my virtual consults, do in clinic, what we do is important, but what the owners do at home is more important. So, there's so much stuff that you could do. And yeah,
Well,
thank you
and of
for
course,
it.
with the TotoFit line of products, I mean,
Yes.
that is such, those are so well designed.
Thank you. Yes, we love them, and they're with, sticking with their phthalate free and latex free and burst resistant, just awesome. So
Yeah.
yeah.
And the dogs really enjoy those activities. And there's
Yeah.
something, you can do with a puppy that's non-concussive. It's still
Exactly.
training, it's still working body position and things that will be important, whatever your dog sport. And
Absolutely.
it's fun, just fun.
I've laughed. I think I told you I added a little Brussels Griffon to my household.
Yes.
And I mean, it's so funny that he's got, like, I've never had a little dog. So all this energy and, but just like doing some core work and all of that wears him out. It's like, great, rather than, like, I cringe when my husband playing ball with him. I'm like, no, 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 no. I'll take care of it. We'll take care of it. So
Yeah.
yeah.
God, when I first met you, you had
Got,
bull mastiff.
I had bull mastiff, water dogs,
Water
bunch
dog.
of everything. Yeah. Now I have my Clumber Spaniel and my little Brussels. So
Yeah. And I remember you doing ball videos and the mastiff going over the ball and
yeah. Oh yeah.
various
Yeah.
challenges back in the early days.
Oh yes, yes. Janet, are there things, exercise, treatment owners can do to help those dogs that experience early spay and neuter?
Oh, yeah.
Yeah, definitely. And this is, without getting into that heated topic about that, if you obtained your dog and they're spayed and neutered early, it is what it is. We can just do the best. Certainly, again, getting back to good nutrition, good supplements, but working on core. A lot of times they're fairly weak in their core, and they don't have the angulation there, in their front legs and back legs. So looking at proper stretching and core strength, so important. Being smart too about, like, what comes to mind is I have a 12-month-old Great Dane I'm working with, and he was rescued. He was neutered at 3 months. His muscle development is not wonderful. And, really working on, his owner wanted to do, and I gasped at this, fly ball. I was like, no, it's not a great activity because he doesn't have that motion, his body, all of that sort of stuff. So, to do an activity, she's doing, starting to do nose work with him, which he loves. And so that's great. but really, looking at, we got him started right away on the JOPE, the UC2 supplement, regular strengthening and exercises, and really being cognizant of any sorts of injuries, and if something pops up, to treat appropriately. So,
Do you have
yeah.
any experience with dogs, Jerome?
Oh, yeah. So
How are
I
you
haven't,
seeing that?
I haven't used it or had it used on a dog. We've had dogs be put on Stanzanol, that were showing either neurological weakness early on from different sorts of things. And we had really good benefits, during that. But I think that's something, it is very, interesting to look at something like that.
Yeah, and for those of you who don't know, it's actually a hormone replacement. So obviously for males, but there are also various products that are intended to replace female hormones, and they might be helpful.
Yeah.
Activity behind my house.
It's okay. I'm in a busy,
Hotel.
yes, all good. Classes went in, so it's a little bit quieter.
Oh, yes. Yeah. But as Irene had a comment too. Oh, come on, get in there.
Gotcha. So the cause of slight hawk legs on a Sheltie. So if this started, young, part of it could definitely just be that's the way the Sheltie is. I mean, certainly Shelties are herding dogs, so we're going to see a little bit more of an angulation in their hocks. If you're right with, trying to strengthen, I would look higher up, actually. Making sure the hips are okay and the knees, that there's no compensations going on there. But like without really seeing the dog and feeling the dog, I would say your best bet, again, sound like a broken record, but good core strength, not playing out of control, ball throwing, good diet, good supplements, that sort of stuff. So,
yeah, that's the foundation of everything.
Yeah, absolutely. Yeah, definitely.
Like that. So classes just went in. How long is the conference?
It ends tonight. Yeah. So it started Thursday, and all day yesterday, all day today, and then tonight. So fly home tonight.
All right.
Yeah, it's been fun, and I'm excited about the Healthy Dog Expo. It's always such a great group, and it'll be great to see friends and stuff like that.
Well, and I know you're also a proponent of 1TDC.
Yes. So, and I don't know if we were part of a trial to try out a stronger formula. So I don't know if they're going to release that soon. But yeah, 1TDC so good for an array, like not just the athletes, but so many of the older dogs, as well. So love it, and such a great product.
I found it fascinating that you can use it as an anti-inflammatory topic.
Yes, which
I think of these TPLO surgeries.
Yes.
And they need to heal fast.
Right. Exactly. And I would always joke about using preparation H to reduce the inflammation. And 1TDC is a little bit sexier than, so it is great to just pop it open and rub on the incisions. So yeah, fantastic. And I've also been using it with some of my wounds, like, for a variety of different things. And we use a lot of Manuka honey, and I've been noticing that works great, but the 1TDC capsules work great also.
Yeah. So no, Olivier will be up at the expo.
He's always so good.
Yes, him and his camera. So when you guys see a guy with this huge camera bopping around, it's just Olivier.
Yes. Such a nice man.
Yes, definitely. Let's check in the comments here. Oh, fly ball. So what do you see a lot of fly ball dogs?
I do. It's not, I kind of had this thought process about 10 years ago that um, if people are going to continue to do fly ball, let's condition them properly.
Mhm.
So, working on making sure that they're turning in both directions so there's not so much wear and tear on the body.
Right.
But, I think, yes, they're fast dogs, but they need to be lean. They need to have incredible core strength. I actually had set up one of the smaller dogs, and then also we did it on a Malinois. We took the 80 centimeter Infinity and wedged it up against a wall, and we were having them turn on that in both directions for strengthening and a plyometric type activity. So
Mhm.
to kind of grab that in as more dynamic and prepare them for it.
Yeah.
So
I wonder if you could somehow put a force plate against the box
I
and
would love to do that. I
see
know.
how hard they're hitting that box when they turn.
It's actually, I mean, you could, take some photos of dogs hitting that box and see where their body is. And
Yeah.
it's pretty incredible to see, all the changes that are happening and the potential stresses
Yeah.
on the body. So, for me, I always think like, okay, small dogs, if we're going to do it, make sure again in they're in a good weight and all
Mhm.
of that. So,
Yeah.
yeah.
And the sport that really seems to be taking off everywhere now is dock diving.
Yes. And that I think is interesting because we don't know the ramifications yet.
No.
Um, you know.
And I think of those dogs, depending on how they hit the water,
Mhm.
just slapping their abdominal organs,
Mm.
you
Hmm.
know, not only, are they hitting with their limbs and, stressing takeoff, landing,
Yes.
but water when you're flying that fast can be pretty hard.
Yes. I think about that. I also think about what happens to that tail when it hits the
Yeah.
water and the extreme extension. And, I've seen enough x-rays or radiographs where there are changes occurring on the tail segments and,
Mhm.
what is starting to happen there. So, yeah.
Yeah. And, I'm thinking of the variety of dogs. A lot of people are jumping, labs and such, and then whippets, greyhounds,
Right. Right.
sighthounds that have 0
Oh,
body fat.
exactly. The deep chested and what's the impact? I mean, if, I'm sure, maybe not if people have done it, just kind of belly flopped in the water and the bruising that you get on
Mhm.
your abdominal area is pretty significant. So, I, I think about that and, like what is going on there. And I always pay attention to the dog's diaphragm and get a little bit into visceral movement. But whenever I see them, they're restricted in that area. And, there's a lot to think about. And that's like another area that will be nice to look at.
Well, and I just think again, the repetitive nature, people
Right.
want their dog to jump, jump, jump,
Right.
so they go, pay for a lot of splashes.
Right. And the warm ups, are they warming up properly? And like you said, with even the Malinois, they have like zero body fat.
Yeah,
And are they properly warmed up and cooled down? So,
yeah. And what is the temperature of the water?
right, right.
I had a client go to a national competition, and they didn't heat the water.
Oof.
And, of course, the dog jumped once, and that was pretty much it.
Yeah.
Um, but, it can't be good to just suddenly immerse yourself.
Mm-mm.
We're not doing the polar plunge here.
No.
Not
um,
not at all.
yeah.
We had one question back here about Myos. Have you
Mhm.
had experience with Myos?
Yes. So I like the Myos. I think the veterinarian formula is the way to go.
Not the over the counter.
Correct. I think the level of fortitropin is higher and um, you get more bang for your buck with it. And they have made a larger container of it, but I like it with my sporting dogs also, my older dogs and neurological dogs. So we do sell a good part of that. And something else, I'll put a plug in that Dr. Curtis Dewey, one of his products, Cognicaps, has been a game changer for those senior dogs.
Really?
For cognitive function as well as physical function. And we have those on my website, and we sell them a lot in the clinic. And I'm just always, and a recent study came out, and I'll post it maybe after, looking at the changes within a month of taking Cognicaps on some of these older dogs with some cognitive disorders. And that's just a part of life. But I've had owners say they just absolutely change their dog's life, and it's incredible. So
That really is, because aging, we're all going to age.
Absolutely part of life. Like, like, God willing, we'll all get there.
Exactly.
Yes.
Right. I think we're all caught up. So I'm going to let you go, Deb, because I know you have a session you want to get into. But thank you so much for taking some time out.
Yes, thank you. And you guys have all my, I think I can write in this. If, anything, can reach out to me through my website or Facebook, or if you're on Instagram, wizard.of.paws. It's usually easy to get there, but yeah. And I'm so looking forward to those of you that are at the Healthy Dog Expo. And I will second what someone wrote there, that it is a credit to Dr. Lori about the people she brings in and how dedicated and how awesome she is.
Well, thank you.
You're welcome. You are welcome.
And yeah, I'm looking forward to it too.
Yes.
So thank you guys. I'll be back to you next week.
Sounds good. Have a great rest of your weekend, everyone.
Bye for now.